I'm Dr. Mike Blaney, General in Bariatric Surgery in Augusta, Georgia with Doctors Specialist, Bariatric and Surgical. So I grew up in the military from a military family and was fortunate enough to go to West Point, the United States Military Academy for college, and I went straight from there to Emory Medical School and then came back into the military and did my surgical training at Eisenhower Army Medical Center. I was active duty in the Army until the year 2003 when I left active service and went into private practice in Augusta, Georgia with our surgical group. So I've been actively performing bariatric surgery since I graduated from residency in 1999. In 2003, I inherited the practice of a retiring surgeon named Harold Engler, who had been practicing weight loss surgery in the Augusta community for about 40 years. And at that time, as a new surgeon joining the group, and in his retirement, I assumed the care of all of his patients. It's really kind of become a love and a passion, taking care of the overweight population, and developed the practice of laparoscopic bariatric surgery. My interest in weight loss surgery really was, I think, something that really just I kind of fell into. In residency, we did quite a bit of weight loss surgical procedures, and one particular story I remember was a patient that I treated as a young junior resident, and I remember her commenting to this day, and I can remember her name from almost 30 years ago, and she said, "You know, this is going to be your life's work." Yeah, there's so many favorite stories when I think about the patients that I've been so fortunate to treat, but one story that really comes to mind is a gentleman who had been homebound for the better part of 3 or 4 years, and his wife actually had contacted our office and wanted to know how we could help him. And at the time, we weren't sure exactly how much he weighed. We estimated he was probably in the 700, 800 pound range. And there was no way this gentleman could even get out of his house. He lived in his living room under a bed sheet and had not been in clothing for Lord knows how many number of years. So me and our team went to his house. We did all the preoperative work that we needed to do, and the very first time he left his house was on the day of surgery. And we had to have a team of people to help him get out the door, into an ambulance, to come to the hospital for surgery. Did his surgery, and he did excellent, lost a ton of weight, and 2 years later he was walking, he was got his life back and was living life again. What I really find also especially rewarding is when I've performed a procedure on a family member and they trust us enough to refer their sons or their daughters to our practice. And to me, that's really something special. If somebody trusts us that much that they will, entrust the lives of their children in our hands is, something I hold dear and special. The relationship that we build with our surgical weight loss patients is quite different. It's much more like a family practice or internal medicine relationship, where we get to know the patient over the long term, to include their family members, and it's really enjoyable to see an individual lose a lot of weight and basically get their life back, lead a happier, healthier life. And that's really one of the themes, personally, that I hold dear in my practice, is helping an individual lead a happier, healthier life. The why we do what we do is to give people happiness.